Safe Work Australia recently released key work health and safety statistics for 2021. You can see the information from the link which you can see in the bottom of the screen there. My name is Risa Yusia Sunindio. In this video, I will share my thoughts and comments concerning the information, and particularly I will focus on the statistics in the construction industry. Let's start with worker fatalities. So the construction industry is the third highest rank when it comes to worker fatalities. So as you can see from the screen here, the fatality rate in the construction industry is 3.1 fatalities per 100,000 workers. And on the figures below, you also can see the corresponding number of fatalities in the top three industries. If we compare with the rate for the entire country, so the fatality rate for Australia is 1.5 per 100,000 workers. So therefore, the rate in the construction industry is actually more than double the industry or the national average. And you also can see that the number of fatalities for the entire country in 2020 is 194 fatalities. Construction contributed 36 fatalities, which is a big proportion for the entire number of fatalities in the country. Just as a comparison, the fatality rate in 2010 in the construction industry was 4 fatalities per 100,000 workers. So even though, yes, the rate is still, well, not good enough, the rate has to be reduced further, but there has been improvement in the past 10 years or so. Next, my comment will focus on worker fatalities by age group as presented in this table. So it's interesting to see that the fatality rate is increasing the older the workers are. So this is for all the industrial sectors in Australia, not only in the construction industry. So I think, again, as you can see from the table, it's pretty obvious. Under 25, the fatality rate is only 0.4, but then 65 and over 5.3, significantly higher. So based on this fact, I guess I have 4 questions to consider. The first one, why are older workers more vulnerable despite their experience? So logically, they should have worked for a much longer period of time. They should have accumulated experience, but then they are more vulnerable. Why is that? The second question, what are the causes of fatalities among older workers? So what are the characteristics? Is it related with what they do, with their occupation? So what are the reasons behind the high number or the high rate of fatalities among this group of workers? The third one, how can they be better protected? Is there any effective intervention to improve their work condition? And the last one, what are the trends in construction? Is the construction industry following the same trend as the industry average? So I think we need more research or more information to address these 4 questions. Probably Safe Work Australia already has the maybe the complete statistics. We may need to dig in further so we can provide better work environments for our older workers. The next one is about fatalities by states or territories, as you can see from the diagram here. I would like to point out these 2 places, Northern Territory and Tasmania. Even though the number of fatalities are not big, 6 in Northern Territory and 8 in Tasmania, but then if we see the fatality rate, they are actually much higher than the industry average. So again, this is not only for the construction industry, but for all industrial sectors. Remember, in Australia, the fatality rate is 1.5, but in the Northern Territory, it's 4.6, and in Tasmania is 3.2 fatalities per 100,000 workers, so significantly higher than the industry average. So therefore, I have a couple of questions. Why are the rates considerably higher in these two locations? And then the table here is the fatality rate in the construction industry in different places in Australia, in different states and territories. The statistics is a bit old, so from 2009 to 2013. We can see the same trends as well. In the Northern Territory, it's 6.3, which is very high. In Tasmania also is the same story, 8.3. So it seems like the condition in the construction industry also reflects, I guess, the overall condition in all industrial sectors in these two locations. So therefore, why the rates are higher in these places? My next question is, what are the trends in construction when other indicators are used? Okay, now we have the information based on the fatality rate. But how about if we use other indicators? Is the condition the same? Meaning, are the conditions in those two places are worse than in other states and territories? Then we need to find the reasons as well why they happen. So therefore, again, improvement strategies or interventions can be implemented to improve the work environments. Next, let's see about serious claims. The construction industry is the second highest in terms of the number of serious claims in Australia. So as you can see again from the diagram on top, construction is responsible for 13% of serious claims. The frequency rate in construction, so the frequency rate is serious claims per million hours of work, is 8.5, while the industry average is 6.1. Again, showing that we need to improve work health and safety in the Australian construction industry. So in terms of the frequency rate, construction is ranked number 5 after agriculture, forestry and fishing, 9.6, manufacturing 9.1, transport, postal and warehousing 8.9, and healthcare and social assistance 8.6. Just as a comparison, the frequency rate in 2011 in the construction industry is about 9. So therefore, the industry has improved by about 7% in the past 10 years, while the industry average, the improvement rate is 16%. So again, showing that the improvement rate in construction is slower than the industry average. The last one I would like to highlight is serious claims by mechanism of incident. So the diagram on the left is the statistics for all the industrial sectors in the country. Body stressing is the #1 source of serious claims in Australia. The table on the right is from the construction industry as reported by Safe Work Australia in 2018. Likewise, muscular stress is the main cause of injuries in the Australian construction industry, whether it's in building construction, construction services, and heavy and civil engineering construction. As you can see from the table, muscular stress is the #1 cause of injuries in the construction industry. So I guess again from this fact, I have one key question there. Can we reduce manual handling in construction so we also can reduce body stressing and muscular stress? I think the adoption of new technology can reduce manual handling, and in the long run, this should contribute to reducing muscular stress and body stressing, which also result in the decline of serious claims. So thank you. That's my last slide. I do hope you enjoy my quick thoughts on the information provided by Safe Work Australia. Thank you.